Welcome, City of Laredo employees. This is Dr. David Cruz, and today I want to talk to you about your Buena Vida lab reports. Now, we always encourage you to go back and talk to your primary care doctor and show them these results. But for an overview, we will go through them today so that you can understand them better. Okay, if you guys are ready, let's start off with your cholesterol level. So first of all, your total cholesterol level should be under 200. Now there's a few lab values that we look at this. We look at your HDL, which is your good cholesterol. We want that to be over 40. The higher the better. And your bad cholesterol, or the LDL, and that should be under 100. Now if you're diabetic, we want that value under 70. So a lot of times if your LDL is over 70, you're diabetic, your doctor is going to want you to be taking a statin medication to decrease your levels. There's also a level there for your triglyceride level. Triglycerides are like fats, and they combine into 3 fat units together, and that's why we call it triglycerides, and those should be under 150. There are special medications also for your triglycerides levels. They're called fenofibrates, or there's also omega-3 fatty acids, which we give for your triglyceride levels. So those are some of the things you can ask your doctor about. Now let's go on to the glucose level. We give you 2 levels of your glucose. The first is what your glucose level was at the time of your blood being drawn. And that level, if you're fasting, should be under 110. And if you're over 110 and closer to 126, and that's more concern for diabetes. But we also do your 3-month level average, which is your hemoglobin A1C. The hemoglobin A1C will tell us more or less how your sugar's been running over the last 3 months, and that will give us a better indication whether you are diabetic, you're pre-diabetic, or your blood sugar is normal. A normal hemoglobin A1C is going to be under 5.7. From a 5.7 all the way up to a 6.4, we consider you to be pre-diabetic. And a 6.5 and above is diabetic. The main treatments for diabetes are diet and exercise. If you can maintain a good diet and exercise every single day, you will bring your sugar levels down. The diet has to be well controlled. Now, I encourage everybody to take advantage of the program that we have going on right now at the Employee Health and Wellness, which the dietitians will discuss your diet with you, help you through this, and it's been a great program so far, and as far as I know, it's going to continue to be there. So talk to your Employee Health and Wellness people so that we can kind of set you up for that. The next values you see on your report are your blood urea nitrogen and your creatinine levels. Now these two give us an indication how well your kidney levels are working and how good your kidneys are working at this time. Under that you see a GFR, and the GFR is the one that tells us your glomerular filtration rate, which allows us to know how well your kidneys are actually working. Anything over 90 is normal. We go through 6 different stages on your kidney levels, and that's the way doctors kind of look at this. So if you're 90 and above, you're normal. If it goes from 60 up to 89, you're stage 2. After that, you start dropping into stage 3. And there's a stage 3A and 3B, and there is a stage 4, and there's 5, and then there is stage 6, which is dialysis. Sometimes dialysis is also done in stage 5. It's very important to take care of your kidneys. How do you do this? You take care of your diabetes, first of all, make sure you're well controlled. Your blood pressure is also going to put a lot of pressure on your kidneys, and you have to control that blood pressure. So when your doctor tells you to take blood pressure medications, take those, because that will control your blood pressure and keep it better controlled. How do we control once we start seeing problems with your kidneys? We start seeing protein in the kidneys. We control that by giving some medications that help with your blood pressure. Diabetics a lot of times are placed on these medications because they protect the kidney, and we know that diabetics have a lot of issues with the kidneys. And they're usually called ACE inhibitors or ARBs as well. Those 2 medications are very important to take for protection of your kidneys. when given by your doctor. The next couple of levels that you see there are your sodium and potassium. Usually the body does a very good job of controlling the levels of this. However, we can see your sodium go way down if you're overhydrating with just plain water, or if you're dehydrated, the levels may go way up as well. Both ways, either way high or way low, can give you problems either to your whole body, your muscles, your brain. And so it's very important to keep hydrated and making sure that that your kidneys are working well, because that can also determine how your levels are controlled in your body. For the potassium level, there's a very small level of normal, and your body does a good job again of doing that and taking care of that. However, sometimes when you have people that don't have kidneys that are working well, they can retain a lot of potassium. Sometimes people may take more potassium. Usually your kidneys will get rid of the extra potassium, but we always have to be on the lookout for that. So high potassium or low potassium will give you a lot of times the same symptoms. They'll give you weakness to your muscles. You'll feel very tired and fatigued. You may get cramping, and it can affect your heart to go into a different rhythm and is deadly as well. So you have to make sure that this is normal. Next up, we have your chloride and carbon dioxide as well. Those levels should be normal usually. Your carbon dioxide, of course, is controlled a lot with your breathing rate as well, and sometimes we can see those levels drop very low or go up very high depending on your breathing rate or any other problem that's going on with your body. So that's something that we just follow closely. A lot of times we see that level of your carbon dioxide go way abnormal when there's breathing problems, or you're sick, or there's some sort of infection going on as well. So we have to be on the lookout for that. Now, your calcium levels are very important to keep maintained. That also controls a lot of how your muscles work, how your nerves work. And so if the levels go too high or too low, that's problematic as well. So that's a level that we need to be on the lookout. Now, if we start seeing it go either too high or too low, your doctor is going to start doing some other labs to make sure that everything's okay. Now, we may see this on the labs that we already drew here, as far as your kidneys being abnormal, not working as well, some other things that can happen as well that may bring it high. And so those are the things that we will be looking out for, and your doctor will be looking out for as well. But definitely, this is anytime that you see any of these values abnormal, it's a good idea to get your doctor to follow up and do other labs after this. After your calcium level comes several levels, comes your total protein, the albumin, the globulin, your total bili, alkaline phosphatase, AST, and ALT. All of these deal with your liver. So if we see any abnormalities in your liver, we have to ask certain questions. We need to know if you are drinking too much alcohol, if you're consuming medications that can affect your liver, what you're eating as well can affect your liver. Sometimes people have just a fatty liver, and the fatty liver can cause your enzymes to go higher. You can also have gallstones. You can have other things that are worse, such as cancers as well. And so a lot of these things have to be followed up. So if we start seeing your bilirubin go higher, or we see your liver enzymes, the AST and the ALT go higher, then we really have to be concerned with those and get follow-up labs by your primary care doctor as well. There is one more lab also that it's called a GGT, and GGT is possibly the first enzyme that starts going higher when we start seeing something going on with your liver. So if we know your GGT is high, then we know that there's something going on with your liver. A lot of times we see people that drink too much alcohol, their GGT will be the first one to start going up, and we already know at that point that there's going to be problems coming up with your liver. And so those are the times that people have to really start considering whether they want to continue damaging their liver or not. The last two labs are the uric acid, and there's a ferritin level as well. Now, uric acid, we see it go high on people that have gout, people that drink too much alcohol, people that eat too much red meat, and also people that maybe eat a lot of asparagus. There's other foods that can also have a lot of uric acid as well. So uric acid can either be under excreted, so you don't get rid of it too fast, or you produce too much of it as well also. You worry about it when it's causing a lot of joint pains and you're getting gout. Gout can be a lot of times starting one joint, like your big toe, where it gets red and swollen, very hard to walk, very, very painful. There's medications that we give for that, such as colchicine and indomethacin. However, it can keep on spreading, so every time you get it, it can get worse and worse and worse and affect other joints in your body or maybe your whole body. So that's something to be very careful with as well. They've also started associating a high uric acid with maybe some heart problems as well. So I think it's very important that if your uric acid is high, follow up with your primary care doctor so that you can continue to follow this closely. Now, your ferritin levels give us an indication of your anemia or how high your iron levels are. If your ferritin levels are too high, then I recommend that you do get some iron studies. The iron studies will indicate closer to what's going on with your body, and in addition to that, get a CBC or a complete blood count. That CBC, which we don't do with Buena Vida, will give us a better picture of whether you're anemic or you have too much blood or what else is going on with your system as well. Since the Buena Vida does not do a CBC, then I do recommend that you go with your doctor if your ferritin level is too high or too low, because that will give us an indication of whether you're anemic or whether you're iron deficient, and that will be very important as to what studies you're going to do next. The things that we worry about with iron deficiency is whether you're losing too much blood, either through menstrual cycles or where you can't see it in your stool. And if you're losing it through your stool when you're going to the bathroom, then that's a very good indication to get a colonoscopy done or a study to make sure that you do not have blood in your stool. Now, the Employee Health and Wellness does have the stool kits that can be given to you so that you can do that test, so that if you do have blood in your stool, then you can go to your primary care doctor already with that result so that they can move on to the next step. Now, this was a quick review of your Buena Vida results. If you have any other questions, make sure to talk to our nurses down at the Employee Health and Wellness, and they'll be glad to help you out. And definitely talk to your primary care doctors and give them these results so that they can know what's going on with you. I do highly recommend all city employees to get these Buena Vida results done and to follow up with all the employee health and wellness activities that we have going on all the time. Thank you very much.